Good evening, everyone, and welcome back to another episode of the Healthy Reset, where we will be discussing again issues with menopause and everything menopause related. Tonight, we have with us our co-founder of the Healthy Reset, Nurse Maria, Nurse Joseph, and she will be talking tonight about skincare and why it's important to have good skincare techniques and what secrets she can share with us about improving skincare, especially when going through menopause. Now, there's lots of tidbits in here, so I say stick around to the end. And if you're watching live or you're watching this as a replay, come on and hit like, share, and hit the notification bell and join our channel so that we can help to grow our community of to help more women and transition through menopause with ease and dignity. Right. So that being said, I'm Dr. Z. And I am just emceeing tonight for Nurse Maria. So, Nurse Maria, I want to start off with some questions tonight, just to get to know you a little better as we're coming down to December
Yeah.
and it's coming down to the end of the year. We're going to start the year off with a bang, right? So, we're going to put a little offer at the end of this about how to start off the new year with a bang. So stick around to the end. Lots of things to be shared about skincare and what we have in store for coming into the new year. So welcome, there's Maria. Come on, you're our co-founder of the White Rose community. Tell us first off. Let's tell us about yourself. What was it that made you start the White Rose community and come up with this brilliant idea of helping women through menopause?
I want to say thank you again to all of our viewers. Thank you for Dr. Khan. Is my one of my biggest, greatest support as we do go through this process. And for all our supporters who are always there with us regularly, like Miss Atwell, Miss Williams, Miss Manzano, Makisha. And what I would like to say, I have been a midwife for more than 12 years. I've been a registered nurse about 20 years now, and a sexual health nurse about 8 years plus. So I have a wide range of experiences in this area. And the catalyst for me was not just patients who came to me on a regular basis and was asking me how to get through this process. What am I as a woman going through this process? Because we talk. And sometimes as professionals, we tend not to share certain things with patients, but something as personal as menopause and particularly sexual health, women's health, we were able to exchange a lot of similarities, which was one was menopause, and they were asking me how was I coping, and I would tell them I'm a healthcare provider, and it has been difficult for me. So, and I have a lot of the knowledge, and it was hard for me. So when it started to come on a regular basis and I started to give out advice, what I used to do and what I'm doing, and a lot of the things that they could do to help the process to be easier, the idea came to me that, this is a process. This is a process I am going through, and I'm having so much trouble. So I can be, as a professional, I can help a lot of other women go through this process. I also got into contact with Dr. Khan. He came and he was doing burnout bias. And one of the things that he did, he introduced diet as part of the regime. And I realized that when I lost weight, a lot of my symptoms decreased. Hence the reason I went to him, and our menopause White Rose Society was born. We combined our both specialties to help women through diet, through exercise, through stress release a lot. And we came up with the White Rose community to help a lot of women, because a lot of women feel very invisible at this time. They feel that they cannot talk to anyone about it, because a lot of times even their male partners, they don't understand what they are going through, and hence the reason the White Rose was born. And we are here to offer this service as an ongoing feature to all women who are interested in gaining better health, whether it is emotional, psychological, physical health during this time. So that is the storyline, the backstory behind the White Rose community. So tonight, I would like to talk about skincare.
Before we jump into skincare, I want to ask you a few more questions about, not just you starting this community and so on, but what in your so what do you do as a nurse? What's your professional standing? I know you've mentioned to me sexual health and women's health, but go tell us a little bit more about that. What is it?
Okay, well, at the moment, the area I am is I'm a sexual health nurse, pap smear and sexual health nurse. So one of the things I do on a daily basis is doing pap smears, right? Which is something very important to women in premenopause, perimenopause, all this, sexual activity. Once you're sexually active, we also encourage women, even if you start very young, with what the new guidelines are. If you start young and you've been sexually active at least a year, we advocate that you come in and you do pap smears, because it is one of the earliest ways of screening cervical cancer, right? So this is one of my the main things I do. I also do contraceptives, the various types of contraceptives, whether the oral, the injectables, the IUCDs. We have all of that available for women, and we have education as to how it pertains to their general health, when to stop it, when to continue, the side effects, so we screen them and make sure that they are the right candidate for the various type of contraceptives that we have available. So I do this on a regular basis. I do a lot of talking to women. So hence the reason why, I meet a lot of women who are going through this struggle called menopause, right? And to make an easier transition through education.
So lots of counseling involved. And I have
Yes.
to say to the ladies who are joining our community, we do counseling in our community with Nurse Maria. As you can see, with her extensive expertise in counseling women through these changes. We do it both live and we can do it through the online format like Zoom or one of these formats also. Right. So that being said, we're always doing these interviews on the healthy reset with women. And in the future, we hope to get some gentlemen on the show. And we're always, I always think to myself, I'm asking these people questions, but I never really got a chance to ask Nurse Maria about herself and what she's doing here and how what this community is about and all this stuff. So I thought it'd be a great introduction to start this show this evening, as it's our last show till the end of the year. And we'll be back in January. We're aiming to come back on the second week in January. So that would be January the 7th, I believe. Right. And so that being said, let's dive into today's topic. And this one, I'm going to hand over to Nurse Maria. She is expert in skincare. As you can tell, I have lots of skin up top to take care of. So I'm going to leave it to Nurse Maria to lead us off on skincare. Nurse Maria, the floor is yours. Enjoy.
Thank you. So this evening, I would like to deal with skincare, and menopause. Why skincare changes during menopause? Estrogen is a very important hormone in adult physiology, and it affects both men and women to a greater and lesser extent according to your gender. It plays a key role in reproductive health and almost every other system. Your skin, of course, is no exception. During menopause, when levels of estrogen in your blood begin to fall, the complex biochemistry of your skin changes significantly. This causes a number of changes. And let us look at one of the main changes, which is drier skin. What is dry skin during menopause? Dry skin is when your skin becomes dehydrated, it becomes flaky and prone to more irritation, which can be very uncomfortable and undesirable. What causes it? What causes dry skin? Now, the main reason behind it is declining estrogen levels. As we know, levels often begin to decline during your 40s, even before you reach into the perimenopausal phase. And these hormone decreases cause changes in the body that lead to skin becoming drier, it becomes thinner, it becomes less firm. As a result, the skin becomes more sensitive and more prone to irritation and sagging. So we know a lot of women at this stage, they go to the doctor and they go to the skin specialist to get help at this time when they try, many of us try our best, and this sagging skin persists. So also, we also have testosterone to a lesser extent, but testosterone plays a heavy role at this time as well. Testosterone levels can also exacerbate the dryness, believe it or not, in your skin. And it's one of the roles of testosterone as well. And I don't want to get off topic, but it could help you understand some of the other symptoms you go through. It includes not limited to stronger bones. So testosterone helps women to have stronger bones. Hence the reason why when we are decreasing in these estrogen levels, we are more prone to osteoporosis, falling down, breaking of bones or hips. Improve ovary functions. Yes, testosterone is responsible for that as well. So helping our periods to be more regular, and possibly it helps as well with a clearer mind. So hence the reason we have brain fog, less testosterone. It helps with better mood, and it helps with the higher sex drive. So we see that the testosterone and the estrogen and the progesterone, they all work together to help in these areas. So the sex drive decline, less testosterone. And one of the things that does as well, this tiredness that we always experience during this time as well, a lack of testosterone as well. So we see the reason why some of the other symptoms accompany this dry skin. What is actually happening in your body that causes our skin to become dry like this? Well, with the less estrogen during this menopausal time, it contributes to skin dryness. Estrogen, one of the roles of it is to promote water retention in the cells. So when it starts to decline, the capacity of the cells to hold water, causing a reduction in the volume that makes the skin appear, it makes the skin dry and appear less full. Hence the reason why we start to get the drooping skin and, and the more pronounced laugh lines, frown lines, and things like that. The drop in estrogen also causes the top layer of the skin, which is known as the epidermis, to become thinner and increasingly dry and sensitive. And another thing it does as well, it causes what we call atrophy, which is the cell becoming, which is the thinning of the the cells, particularly the when we do, I can see it particularly when we do pap smears and a woman who are postmenopausal or going through the menopausal phase or the perimenopausal phase, the skin becomes thin and pap smears become a bit more uncomfortable physically, because we know emotionally it is uncomfortable, but physically and emotionally it becomes more uncomfortable because it becomes painful. So hence the reason why when women reach a certain age, where the cutoff age is 65, we stop um having pap smears, because that thinning skin, it causes a lot of discomfort, irritation, bleeding due to the thinning of the skin layers. What are some non-medical treatments for dry skin in menopause that you can do at home? It is important to know that most treatments for dry skin during menopause are non-medical, and they primarily aim to support your skin as it changes. Moisturizers, the importance of moisturizing, having a routine, regular skin care regime on a regular basis. Not when you see a blotch or you find the skin looks dry. You have to incorporate moisturizing the skin. As the skin loses the ability to retain water, locking in moisture becomes particularly important. So regular skincare by a professional, and then getting that advice to go home with certain moisturizers according to the skin type you have and whatever issues you have, it is vital at this time. So moisturizing products on the face can include cream, cleansers, heavier night creams to retain the moisture in the skin, and substances that help the skin to hold onto the water that it has, like hyaluronic acid or the ceramides that we see in certain creams. Avoid products that dry out the skin, like foaming products, and those that contain alcohol, alpha hydroxy acids, or salicylic acids. For the body, use use a cream rather than a lotion, and look for products designed for sensitive skin, because we see here how our skin becomes very thin, it becomes very irritable and sensitive at this time. So these are some of the things you can use. You can also look at using retinols. Retinols are substances that are derived from vitamin A. Retinols are, you can get that over the counter. Substances applied to the skin to reduce dryness and to decrease the signs of aging. They penetrate through the epidermis to the middle layer of the skin called the dermis, and then help to reduce the fine lines that we have, particularly around the eyes, around the mouth area, over the eyes, and they help to reduce it. So the fine lines, and also another thing it does, it helps to promote collagen. Now, what I want to interject here as well, one of my go-to products that I use on a regular basis is the collagen powder. I use the marine source collagen powder, hydrogenated, because it breaks down easier in the stomach. And because I don't eat meat, I use fish. The marine source is the better one for me. Those of you who consume meat, you can use the one that has the meat protein, which would work and help you work better for you. So, and you also can have foods that help with increased collagen, things like, for example, pumpkin seeds, sunflower seeds, all of these help as well with the production of collagen. Right? Retinols are related to but milder than retinoids, which require a prescription. Another thing we can do is avoid hot showers and baths. Even though it's so comfortable and soothing, bathing in hot water can strip our skin at this delicate time of oils and proteins that keep it moist and supple. Opting for a lukewarm bath with lukewarm water, patting the skin and not rubbing the skin hard. Post bathing and moisturizing right after. Don't wait for the skin to dry out after you bathe. While it's moist, apply your moisturizers. This will help to retain the fluids, the water in your skin. Because after bathing, moisturizers immediately after bathing can lock the moisture in your skin. Hence the reason why I say don't allow the skin to dry out. Moisturize it while it's not too wet. You have some moisture still, and it locks in that moisture. Use SPF daily sunscreen. Thin and dry skin is more vulnerable to harmful damage from the UV rays of the sun, which can also cause spots and discoloration. Daily use of broad spectrum sunscreen, at least SPF 30, can help protect it from further damage and from further irritation. It is also important to reapply every 2 hours, especially after sweating and getting wet. Another thing that we can do to help the skin as well is to cover up. Yes, cover up the skin. Dark spots like freckles, age spots can be worsened by the sun. So covering exposed skin by wearing UV protective clothing, a wide brim hat. So you can see now why our grandmothers used to wear these broad hats. You know, they knew what they were doing. A lot of them when they go out in the sun, they would put on these broad hats, and that was to protect the skin. A wide brim hat, and they also have driving gloves that add another layer of protection. Now, what are effective medically prescribed treatments that you can use now for your dry skin? Hormone therapy is an option for some women. If the skin issues related to menopause become especially difficult to manage, a medical professional may recommend hormone therapy. This treatment comes in the form of prescription that restores dropping estrogen levels, alleviating the root cause of the skin thinning. And this is done, and this can be proved through research. It can improve skin hydration, elasticity, and thickness, and also boost the much needed collagen production in the skin by reducing wrinkling. We can also get from the skin specialist prescription retinoids, closely related to retinols, but much stronger. These substances reduce dryness and signs of aging through a number of mechanisms. Applied to your skin topically, they encourage cellular turnover. You know, as we get older, cellular turnover is much, much slower. So the skin, that bottom skin that's trying to get to the top takes much longer to reach there as we become older. Hence the reason why you would find the skin is looking dry, it is looking dull, because the skin turnover is much slower now. They also, what the retinols do, they also promote cell proliferation, which makes the skin thicker and less prone to wrinkles and fine lines. Retinoid use also increases the production of hyaluronic acid, a substance that helps to retain water that is so much needed at this time in the skin. Some women also opt to use laser treatment according to the condition and the extent of the skin damage or the wrinkles or the sagging that they may be having. Laser treatments can effectively brighten dull skin and address melasma, which is a discoloration caused by the hormonal changes and other types of hyperpigmentation. So some people, the women, you would find they have a darkening of the area because of the melasma. It would help to even that skin tone. Sometimes it's it's on the cheek, it's under the eye area, different parts of the skin. So it helps with that to help the skin look more supple and ready to go. Another thing that happens as well with the skin during this time, which a lot of women really would like to get help with, but they don't talk about, is the facial hair, which is known as hirsutism. That facial hair that appears under the chin, and some women have the extended sideburns. Some women get the mustache and the beard at this time, and that too, because of the bouncing of the testosterone, the progesterone and the estrogen. Some women have higher amounts of testosterone. Hence the reason why they would have more facial hair. Some women get more hair in their skin, their back, and areas where women are not usually hairy. Right? So there are things that could help lower testosterone at this time naturally, right? Some of them is naturally, and one or two of them, well, is you can use oral contraceptives. So let's start with that one. We can use combined estrogen and progestin, which is an oral contraceptive combination, which can help to reduce the testosterone that causes these problems during that time. Another something that we can do naturally, but with some effort, is weight loss. Extreme weight can cause our hormonal levels to fluctuate and be very irregular, and then you experience the increase of this male hormone, testosterone, that causes these other issues with us at this time. Eating more soy is a natural treatment as well. Eating more soy products can help as well as to decrease the testosterone level. Drinking mint tea. Licorice root is a herb that can be used as well to help. Flaxseed and green tea, which these help to decrease the free testosterone in the blood. Zinc also as well, which reduces the testosterone. And another something that zinc does that a lot of people don't know that it does, it reduces the risk of diabetes. Also the use of cinnamon, which reduces the free testosterone, and cinnamon as well reduces insulin. Omega-3 fatty acids help to reduce the testosterone that gives a lot of these symptoms during this time as well. So these are some natural things that we can use to help if we have certain symptoms like the extreme dry skin, the facial hair, even the acne, skin irritation. A lot of these natural God-given products can be used. What I would like to know, if we any of us have anything that we use naturally to help, that you can share with us other women here during this time, to help with any skin issues. Anybody has anything natural that they use?
Hi, good night.
Good night.
Right, I'm Dale. What I find works for me is
Mm-hmm.
coconut oil, the extra virgin, but it's the fractionated one.
Okay.
So it's not greasy. So as soon as you said, as soon as you shower and come out, I put that on the skin and it really gels into the skin. And so you
Mm-hmm.
don't get, usually if you put oil, you might still feel the dry, you'll feel the greasiness, but the skin will still feel cracked and so forth. But that gives it
Mm-hmm.
supple, a supple feeling. I purchased it. There's a place called Valley Blossom in Five Rivers, just a little past the old secondary school. They have a
Mm-hmm.
lot of herbal stuff, and I find that works me better than just the extra virgin coconut oil, the fractionated one. They took out a certain fat.
Fractionated.
Yes, yes.
Okay. Thank you very much. Ladies, you're hearing that? Coconut oil. That that oil that our grandparents, great grandparents used to make on a regular basis. But this one is the fractionated coconut oil. So, that can be used as well. Anybody has any other um product that they use, any natural product to help in their skincare regime?
Okay, Elizabeth here. My I use the aloe vera Vaseline.
Mm-hmm.
Mm. It works well with my thighs because I have a dryness, not to the back of the thigh, but to the front of the thigh. So it works well. The skin restores it. I get a sense of warmth.
Mm-hmm.
Mm, to me, I will have the warmth, but not too much sweating. The pores feels as though the pores feel as though they are free. I feel clean with it. So that works for me.
Okay. So ladies, you're hearing that other natural remedy. We use that very often as Caribbean women. And it's something we can introduce to other women as well who are listening. The coconut, and the coconut oil, the aloe products. Anybody has anything else they use on a regular basis?
I also use the not too regular, but sometimes to wash the hair,
Mm-hmm.
I would use a little aloes to steam and so on. That's just me. Right?
Aloes. Okay.
Yes, I use aloes. Um, I don't know. Aloes is bitter, as everyone know, as everyone know. But to me, when you have a
Mm-hmm.
product that is bitter, it works so well, but not with a overuse. But it
Okay.
works well. So I use the aloe Vaseline on the front of the thighs, and I also use the aloe periodically in the hair to steam it and so on. To me, I get the hair itself is it feels light, it feels clean, you
Okay.
know, and that's what working for me. Yeah.
So do you apply the oil right after you have your bath, or you wait until your skin dry? How do you do your regimen?
That that's a very good question. Um, as everyone probably know by now, I am 63 years old, so I am post menopause. Ever since probably from the age of 50 right up to now, I've been feeling this warmth. So I would never want to have very dry skin.
Okay.
When I feel very dry skin, I like to after showering, I prefer to leave my skin halfway wet and apply.
Okay.
So yeah, so I don't get the urge to dry up. I always like to have, this the application must be always with water or some sort of a,
Okay.
moisture on the skin. Eh,
And that helps to retain your. So you ever had the problem with the itchy skin when you didn't know what to do at that point in time? You ever had that itchiness?
Right, very good. I had, and surprisingly enough, I didn't know where this thing was coming from until probably tonight, right? And I'm saying that sometimes we can get a fungal infection from, it's so easy to pick up. And I used to be like sitting at home on the living room chair looking at television, not walking through the bushes or not being in a place where something may have stung me. It wasn't like that. It was just sitting, and all in a sudden, I will get like in the same front of the thighs, I will get like these blotches coming out and they will be itching. And I used to say, but like if something is there. And when I started using applying the Vaseline and using more of the aloe base stuff and so on, I realized it has gone. So I don't know. And as we are speaking about this, I don't know if it was something coming from the blood or if it is the fact that the skin was dry, that's why probably I was getting the itching. I'm not too sure. Yeah.
Okay. Thank you very much. Anybody else has a contribution to make in terms of their skincare regime that helps, that is helpful to them, that they can share to be helpful to other ladies going through this issue?
I just want to share, since I got to menopause age, our family has eczemas, but my own really started expressing itself. I've get more on my feet.
Okay.
And it started expressing itself like ringworm. And when doctor prescribed a treatment for ringworm, that it spread until I got a hydrocortisone. So, but I kept thinking it is some form of eczema and so forth. But what I try not to use the hydrocortisone cream to read, because those things absorb in your bloodstream.
Yeah.
And the lady who was speaking before, I find Vaseline, not just anyone, the one like the aloe vera one, and there's a lighter one. It has so much Vaseline out there. It says dermatologically proven, and it's a lighter Vaseline. It's not a heavy, thick one.
Not the thick one.
No. It's still with the blue cover and the normal looking one, but you have to read it's lighter. And I find if I put that on the area, the skin looks really good after I shower. So the Vaseline, I know people like who into herbal and so forth, it has been said that petroleum jelly is like what you use to pitch the road, and it's not good for the skin generally because it blocks up the pores. But I find it works, and that's all my husband uses, and he don't have any issue with his skin.
Okay.
But yeah, it does help and minimize the use of like hydrocortisone creams for the eczema.
Okay. Great information, ladies. Great. Thanks for sharing. Anybody else? What I use, well, I will contribute now. What I use to help me, I use combination of diet and application of oils. My diet, what I found that was helpful to me is the reduction of sugar in my diet. Imagine just reducing that sugar. And when the research was doing the research behind that, I realized that at that point in time, the dangers, how dangerous high sugar is, not just for the skin, but other problems like increased insulin levels, what it actually was doing to irritate the skin. Sugar is very harmful from the cellular level. So I reduced my sugar intake, I reduced processed food, and for me, that was the catalyst that started to help my skin look better. I also use castor oil on a regular basis after I have my bath and my skin is moist, I use castor oil lightly because it's very thick. I use my ring finger and I apply it underneath the eyes and above very lightly and moisturize the skin with it because a little bit goes a long way. So I use the castor oil, and there are a number of oil that I've seen on the market, like the pomegranate oil, and I've also bought a pomegranate oil for myself as well. And I'm using it, so I'll let you all know how that oil is working. I've been using it for probably a month and a half now, and it has been working really good. So that is my regime that I use on a regular basis. I do not use sunscreen as regular as I should, but it is recommended as regular skincare at this time that we use sunscreen to safeguard against sun damage, right? Because a lot of us think it's just the Caucasian woman or the woman with the fairer skin that gets skin cancer, but we are all at risk of getting skin cancer. And usually it shows up later in women of color, but we are still prone to getting skin cancer, ladies. So protecting our skin as well is very important to avoid skin cancer. So this sunscreen is very, very important here for us as well, protecting us from the damaging UV rays of the sun. Another thing, it's useful as well during menopause. Well, we talk about the retinols just now as well, retinols, and the use of that to help keep the skin looking nice and plump and young. And I don't ever want to underestimate how drinking sufficient water helps to bathe the cell. I'm not talking about gobbling down the water. Having the water and sipping the water regularly enough, it helps to send it down to the cellular level and helps to hydrate the skin. So you sip on the water regularly. Some people say, well, I can't drink a lot of water one time. I agree with that. I would sip on it on a regular basis and it hydrates your skin better than getting your tummy full of water. Sip on it and it goes down easier to the cellular level to help plump and help that skin look nice and young and healthy. But again, we can I just want to get one more point because we are just out of time. This topic is it's longer than, it is longer. It's more extensive than we really know. So another point, and then we can go to Dr. Khan. Revive dry skin with lotions. Always talk about the lotions, the moisturizers, the collagen, right? The collagen, ingesting the collagen, which are very important. So I want to introduce you to 3 important things that we can do, which are important proteins to help the skin. We have the keratin, the collagen, the elastin, which are proteins that help retain skin moisture. As I told you all before, my go-to is collagen, and there's keratin and elastin. You can use them in combination as well. It helps to retain that moisture in the skin and have your skin looking lovely, beautiful, plumped at this time. So anybody has anything else to contribute, you can let us know. This is our last show for the year. Talk all we can now because we want to start together the new year. We want to go with a bang. So we can close off with this topic and share what knowledge we have in terms of skincare before I close and put on Dr. Khan.
The The thinning of the hair, is that through menopause as well?
Yes, it is. It is.
Right. So people,
The
you
hair
know,
strands become, yes, they become, because of the reduction in the estrogen, the hair follicles become thinner. So some women would find that the hair strands are very thin. They used to have very thick hair. It it has something called female pattern baldness. It's not like the men, you just see this part, it could be at the top, and you're seeing the thinning from the hairline area. That is
yeah,
also because of 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 decreased estrogen levels as well. And here is a big topic. So what we can probably do for the new year, we can deal with the tips and tricks we can use, things we can use naturally, and some of them medically to help with the hair thinning during this time as well. Because it is a big issue with us women during this time as well. Beside the brain, the hair thinning, the hair loss, the female pattern baldness. So that is a topic we can delve in for the new year.
I would just wanted to contribute one of the skincare. Well, I practice it mainly when I lived in a temperate country, and maybe I should start it back, seeing that I've gotten to menopausal age. I don't know if any one of you all have tried or heard of body brushing.
I've heard about it.
Right. So it's not like using a loofah to scrub the skin. It's a long handle brush, like what you might have brushed doll hair with soft bristles, and the body brushing. So after you shower, what it does, it helps remove like dead cells and unclogs your pores. It helps with circulation, lymphatic drainage. It really does. So when it does that, you will see a radiance in the skin, and it will help the sebaceous glands release that moisture and stuff. It's good for circulation. So you all can look into that. Body brushing is quite effective, and I learned it from a herbalist.
Okay. I read about that some days ago, actually, and they said the Koreans have mastered the technique. The Koreans, if you look at the Korean skin, it is extremely smooth. And if you go to a Korean spa, they say they do that extensively on their skin, face and everything. And it helps that layer of skin that is trapped underneath to come up to the surface at a quicker rate as when you were younger. So their skin is always looking nice and glowing because of that what you just spoke about there. So that is very true. So if you can get to go to a Korean spa and get that type of pampering, you would it would help a lot, help the skin a lot.
just before my bath, I always do that brushing.
You do that as well?
Very, very for circulation. I didn't know what's for the skin as well. I do it for circulation, yeah.
Okay. Thank you. So Dr. Khan, I want to give the podium back to you to close off. Thank you, ladies. We love you all. We want to thank you all for coming on and for being so supportive to our program and the knowledge that we give out on a weekly basis. It has been our privilege to do so for the past year. Thank you.
Thank you, Nurse Maria.
Thank you, Nurse Maria, and thank you so much, Dr. Khan. Thank you for my extended friends and family for being here. When we come together as one, it becomes stronger. Have a good Christmas. Eat ham, not too much. Eat fruit cake, not too much. Don't drink at all, just sorrel and ginger beer. Have a good Christmas. Love you.
Thank you.
All right, so as we're closing off tonight, thank you, ladies, and thank you, Maria, for this very informative discussion on skincare. So as we close off this evening, we know next year is coming along, 2025, pap smears, we offer them. We start to tell women to do them at the beginning of the year, so it's easier to manage how you do it. So we have a special offer from the White Rose community for all you ladies who need to get your pap smear done. So we're putting a package deal together. It's a gift that keeps on giving. So if you want to give it to somebody as a Christmas present, you can. It includes your pap smear, which includes the lab tests and everything as part of the price. And as a bonus, we're offering a breast examination as part of your pap smear package, a counseling session with Nurse Maria. And finally, you get access to Ultimate Weight Loss Recipe, our 7-week weight loss course to get your year started on the right track, where we go through how to achieve weight loss in 90 days or less and to start achieving your nutritional goals for the new year that leads you not into just making New Year's resolutions, but actually achieving them. So all of that is for $597. And it's a special offer. It's available until the end of Christmas. If you need to reach out to us and let us know, I will post the link on the YouTube channel. I will also send it in our WhatsApp group. So anybody who wants to sign up, just let us know, send us a message, and then we'll show you what you need to do to get in a part of the course, and we'll organize and book your pap smear for the beginning of the year and your examination and counseling session. All of that, again, for $597. And it's a special offer that goes until the end of December. That's it for tonight. Thank you for coming on. Remember, go on our YouTube channel, hit like, share, and subscribe. Hit the subscription bell so that you'll know when we have the next sessions happening and you get reminders. We have lots of videos on there to give you more information if you need to. Go on there, and it's on the Healthy Reset on YouTube. You can see it behind me right here, right? And share with your friends and family, and we are trying to help as many women as possible. That's it for tonight, and
Before
have
you go,
a
Dr.
great
Khan,
evening. Yes.
before you go, I want to say a special, before people started to go, I wanted to say a special hello to Miss Gracelyn and Miss Anne-Marie and Miss Rebecca. I haven't seen them for a while, so I just wanted to say welcome to them as well.
Okay.
Thank
Awesome.
you.
Okay, ladies. Thank you.
All right. Have a great Christmas.
Bye-bye.
Bye.
Bye.